arthrokinematics of the glenohumeral joint. As we discussed earlier, arthrokinematics is nothing but the movements which will happen in between the articular surfaces. If we take GH joint, here we are having the glenoid cavity of the scapula. Here we are having the glenoid cavity. This is the glenoid cavity, and here we are having the humeral head, glenohumeral joint. Okay, glenoid cavity. So movements which will happen between head of the humerus and glenoid fossa. Those movements are nothing but the arthrokinematics. What we will see here, if we take arthrokinematics, usually in arthrokinematics, what kind of movements we are having? First one sliding, also called as the gliding. Second one rolling. Third one spinning. So these are the possible arthrokinematics which can happen between any two articular surfaces in our human body. If you want to understand what is this gliding, sliding, rolling and spinning, please check our channel second chapter, joint structure and function. There I have explained very clearly what is this gliding, sliding, rolling and spinning. Now we'll see, suppose in our shoulder joint we have flexion, extension, abduction, adduction and internal rotation and external rotation. In this topic, especially today, what we will see, what kind of movements arthrokinematics will happen during one movement inside the joint. So to understand this arthrokinematics, first we should know what is concave convex rule. First we should understand what is concave convex rule. To understand this also, I don't want to extend the length of the video, so to understand this concave convex rule also, check our second chapter. It is there in our channel. Check second chapter, joint structure function. There I have explained what is this concave convex rule. Okay, now directly I am coming to the point. If we take flexion movement in the shoulder, suppose if this is our shoulder joint, this is elbow joint, this is wrist joint. We are seeing patient, side view. This is anterior, this is posterior. Okay, this is shoulder, elbow, wrist joint. This is anterior to the patient, this is posterior to the patient. Simply to make you understand, suppose one person is standing here, we are seeing the patient laterally. This is patient lower limbs. So this is upper limb, this is anterior, this is posterior. Okay, now it is clear. Flexion movement. Flexion means patient can lift his upper limb like this. This is flexion movement. So here, while patient is doing, what kind of arthrokinematics will happen between the articular surfaces? So here arthrokinematics, anterior rolling and posterior gliding. Simply we can say that posterior glide. And while doing extension means this is forward, this is flexion. Extension means patient will do movement like this, back, that is extension. Here what will happen between the articular surfaces? Posterior rolling and anterior gliding. Simply for extension we will tell anterior glide. Now we will see abduction movement. If we take abduction, imagine patient is standing like this. This is his upper limbs. Abduction movement. This is the abduction movement. If patient do like this, this is abduction movement. Here, while patient is doing abduction, what will happen? Inferior glide will happen. After that, superior rolling. Inferior glide and superior rolling. If we take adduction means patient will come back to normal position. That time superior gliding will happen. After that, inferior rolling. It is the combination of both movements. Superior gliding plus inferior rolling will happen. After that, we'll see internal rotation, also called as the medial rotation. Then external rotation, also called as the lateral rotation. I am saying you again, if you want to understand what are these rolling and gliding, these movements, you have to see our previous videos, second chapter ka joint structure function. In that chapter we have explained all these things, and we explained concave convex rule also. On the basis of concave convex rule only, all these movements will happen. Okay, now if we see internal rotation means, suppose if you take patient shoulder like, okay, this is patient shoulder, this is like chest. Okay, this is like chest. Okay, so here shoulder joint is there, this is our elbow joint. If patient do like this movement, this is internal rotation. If patient move like this is external rotation. Here patient position will be, shoulder will be 90 degrees. So it is like this is shoulder, this is elbow joint, this is wrist joint. So here patient position will be shoulder, elbow will be in this position 90. If patient do movements towards his chest side, that is internal rotation. If patient do movements towards outside, that is external rotation. So here while patient is doing internal rotation, what kind of arthrokinematics will happen? Anterior rolling with the combination of posterior gliding, and while doing external rotation here, posterior rolling with the combination of anterior gliding. So observe this internal rotation and external rotation and flexion and extension. So here arthrokinematics are same for these movements. So that's why usually we will, while doing mobilization to the shoulder, usually while doing mobilization to the shoulder, we are not going to give separate internal external rotation ka arthrokinematics gliding movements on the patient. If we give for flexion extension, automatically it will increase internal rotation and external rotation of the shoulder joint. So these are about the arthrokinematics of the shoulder joint. Clear?